So today we will discuss about iBanking. First, I will tell you some points about history. 1903, Ezam from Czechoslovakia performed first successful human cornea transplantation. In India, first iBank was started in Regional Institute of Ophthalmology, Chennai, and VP Filatov is known as father of keratoplasty and modern eye banking. First successful corneal transplantation in India done by Dr. Danda, and in 1974, McCarry and Kaufman developed MT media, which is a preservative medium from cornea. It allows the corneal rim to be preserved from up to 4 days at 4 degrees Celsius. In 1985, Kaufman et al. Presented case-old media as a storage media. In this, cornea can be stored up to 10 days. In 1989, Eye Bank Association of India was formed. Now, why do we need an eye bank? Because uh, there are lots of people who suffer from corneal blindness. In India, major causes of corneal blindness is infectious keratitis. It is the most common cause of corneal blindness, or we can say corneal ulcer is the most common cause of corneal blindness. Second one is pseudophakic bullous keratopathy. Other is corneal dystrophy, corneal degeneration, corneal injury in form of open glove injury, chemical injury, thermal injury. Other infectious diseases like trachoma and vitamin A deficiency, these all are the causes of corneal blindness. Now, what is iBank? iBank is a non-profit organization which deals with the collection, storage, and transportation of the donor cornea for the purpose of corneal grafting, corneal research purposes, and other ophthalmic purposes to supply the eye tissue to the other iBank and other institute of the medical colleges and other ophthalmic purposes. In an iBank, there are two types. There are two sections. One is medical section and administrative section. Medical section, there is medical director who should be qualified corneal surgeon, and in medical section there should be a trained technician. Administrative section includes eye donation counselor, social worker, health worker, and a clerk. Now, function of the administrative section includes the public awareness program for motivating the function of administrative section includes public awareness program for motivation of the people to donate cornea, liaising with the government, local voluntary and other healthcare agencies, and other function is to collect the funds for development of the eye bank. Now, function of the medical section includes tissue harvesting, collecting the corneal tissue, its preservation and its distribution. Now, function of the eye bank. Main function of the eye bank is public education program and to aware the public about to motivate to donate the cornea, to arrange the training program and development of uniform medical standards. In India, till now there are 5 eye banking training centers, 45 eye banks, 2000 eye donation center, and near about 2 lakh cornea are available till now in India. In eye banking system, there are one eye donation center which is affiliated to the registered eye bank, and function of eye donation center is to aware the public and professionals to about the eye donation. Second function is to coordinate with donor families and hospital to motivate the eye donation, to harvest the corneal tissue and collect blood for serology, and to ensure the safe transportation of the cornea to the parental eye bank. The same function of the eye bank is to provide a public response system over the telephone and public awareness program to coordinate with the other donor families and hospital, and to motivate the uh, eye donation, to harvest the corneal tissue, process, preserve, and proper examination of the collected tissue, distribute the cornea to the other center for keratoplasty, and to ensure the safe transportation of the cornea. In eye bank training system, all of the eye bank function train their personal and medical trainer and other staff persons. for the proper functioning of the eye banking and research purposes. There are some equipment which require for the eye banking, which include the slit lamp, refrigerator, serology for HIV, HSV, and HPSAG, specular microscopy required for endothelial cell count, instrument for corneal excision, autoclave, and laminar flow hood. These all are equipment which are required in the eye bank. Now, how eye bank works? First, we should recover and retrieval the cornea. Then we process the cornea through the multiple process and then distribute the cornea towards the required center. First of all, deceased family call the eye bank, and then counselor motivate the relative of the deceased person and take the consent from the family member. And after taking the consent, we should recover the tissue or retrieval the cornea. Now there are some contraindication of the corneal retrieval, which include systemic contraindications are AIDS, rabies, any active brain disease like viral hepatitis, Creutzfeldt-Jakob disease, SSP, Reese syndrome, death from unknown cause, congenital rubella, active septicemia, leukemia, and lymphoma. And ocular contraindications are intrinsic eye disease include retinoblastoma, any active inflammation in the eye like conjunctivitis, iritis, uveitis, and any congenital abnormalities like keratoconus, corneal opacity, and prior refractive procedure like radial keratotomy. These all are the contraindications for corneal transplantation. Now, what are the preliminary preparation for corneal donation? First, we obtain the legal permission, then go through the donor's medical records. These all are perfectly correct. Wash hands properly and be prepared for aseptic dressing. Identify the donor properly. Then collection of the post-mortem blood should be done around 10 ml for it can be from the femoral vein, subclavian vein, heart or tubular vein. Then we do enucleation first. After the enucleation, we do excision of the corneal scleral button. This picture shows the excision of the corneal scleral button, and scleral incision is about 2 to 3 mm behind the limbus and about 4 to 5 mm in length. मैं क्लास छोड़ दूं क्या? अगर तुम्हें नहीं पढ़ना है तो मतलब तुम आधा घंटा चुप भी नहीं रह सकते हो, है ना? इतनी देर हो गई है, कुछ कहती नहीं है तो मतलब बोले जा रहे हो। और बायोमेट्रिक लगाने का टाइम 3 बजे का है ना, या कभी भी लगा सकते हो? आने के बाद तुम लोग मतलब मेरे आने के बाद एक एक करके यहाँ पे आ रहे हो और फिर चुप भी नहीं बैठ सकते हो थोड़ी देर। प्लीज कीप साइलेंट। अगर नहीं पढ़ना है तो बोल दो, मैं चले जाती हूँ, पर अटेंडेंस किसी को भी नहीं मिलेगी फिर। सीरोलॉजिकल टेस्ट, तुम्हें तो ये भी नहीं पता होगा कि कौन सा टॉपिक है कुछ लोगों को तो। Serological testing include HIV, HBV, HCV, and syphilis. These all tests are necessary for before the corneal donation. Now, evaluation of donor tissue includes gross examination of the whole globe and corneal scleral button examination. Whole globe examination includes the complete examination of the eyes. In case of excessive stromal hydration, we should discard the donor eye. In case of corneal scleral button examination, color of the tissue storage media is to be noted to rule out the contamination. This picture shows the slit lamp biomicroscopic examination of the donor cornea. Endothelial cell count is very important for corneal donation. In case of less than 2000 cells per mm square, we should not use this type of cornea for donation. This list shows the different endothelial cell count at the different age. Average functional cell density should be 1500 to 2200 cells per mm square, and critical density is set when cell count is less than 300 cells per mm square. In exclusion criteria for penetrating keratoplasty, if the cell density is less than 2000 cells per square millimeter, then cornea should not be used for corneal transplantation. In case of extreme polymagacism, in case of extreme pleomorphism, presence of any corneal opacity, any non-hexagonal or abnormally shaped cells, any inflammatory cells, bacteria, debris, and numerous regulated cells. In all these cases, we should not use these type of cornea for corneal donation. Now come to the storage of the donor cornea. There are four types of storage: short term, intermediate, long term, and very long term. In case of short term, we use moist chamber. In moist chamber, only we can preserve 2 to 3 days of. In case of intermediate storage, we can use K-Sol, Dexol, Optisol, and Optisol GS, and in this media we can store up to 7 to 10 days. In long term storage, where we need to store up to 30 days, we use organ culture medium and minimally evacuated medium. And in case of very long term, for 1 year, we used cryopreservation. Mostly we used short term and intermediate storage media. Moist chamber storage is short term storage. We require temperature around 4 degrees Celsius, and we can store it up to 24 hours. Advantage is a simple technique, but disadvantage is there is a lots of chances of corneal stromal edema. Another one media we can use for corneal preservation includes dextran, chondroitin sulfate, electrolytes, pH buffer, antibiotics, antioxidant, insulin, antiprotease, and anticoagulant. These are the list showing the different type of storage media. In MK media, we can store up to 4 days. In K-Sol and CSM media, we can store up to 7 days. In Dexol, Optisol, and Procel, we can store up to 10 to 14 days. Most commonly, we use MK medium and K-Sol medium. Now come to the corneal transplantation. Corneal transplantation means surgical replacement of the full thickness or lamellar portion of the cornea of the host cornea from the donor cornea. It can be two types. Full thickness means penetrating keratoplasty, and lamellar portion means lamellar keratoplasty. It can be two types: allograft and autograft. Full thickness known as penetrating keratoplasty, and partial thickness known as lamellar keratoplasty. This picture showing the corneal transplantation procedure. First we start the. This is the recipient eye. First we start the cornea. Cornea is discarded, and then we take donor cornea, and donor cornea is removed and transplanted to the recipient eye. There are four types of keratoplasty. One is optical. Optical means to improve vision of the patient. Therapeutic keratoplasty. Therapeutic keratoplasty to remove the infected corneal tissue. Tectonic to restore or to maintain the corneal integrity. And cosmetic keratoplasty we should do to improve appearance of the patient. Now come to the indication of penetrating keratoplasty. Penetrating keratoplasty means full thickness keratoplasty. Indications are keratoconus, post-cataract surgical edema, corneal dystrophy, any type of corneal dystrophy, any type of corneal degeneration, mechanical trauma, chemical trauma, any type of corneal injury, congenital opacity, any type of corneal ulcer which involves full thickness of the cornea. These all are the indication of penetrating keratoplasty. Now come to the lamellar keratoplasty. Lamellar keratoplasty means only a portion, or we can say only some layer of the cornea are removed and replaced with the graft. For example, in case of opacification of the superficial corneal stroma, we should remove only superficial layer of the stroma and it replaced by the only superficial layer of the donor eye. Now there are three types of lamellar keratoplasty. First is superficial, or we can say deep, superficial or deep. Two types: anterior lamellar keratoplasty. Second one is Descemet stripping automated endothelial keratoplasty, and third one is Descemet membrane endothelial keratoplasty. Superficial or deep anterior lamellar keratoplasty means only the superficial portion, either the superficial portion or deep portion of the stroma are removed and replaced with the graft. In Descemet stripping automated endothelial keratoplasty, only the endothelium and the Descemet membrane is replaced with the graft. And in Descemet membrane endothelial keratoplasty, only the endothelial membrane is replaced by the graft. Now there are some legal aspects we should follow before the corneal transplantation. First, the qualification of the doctor. Earlier it should be MS of cell, but now it's reduced to the MBBS for the enucleation. And eye donation is always decided by the donor's family members and donor's relative, not by the actual donor. Enucleation, before the enucleation, doctor should take the consent from the relative of the deceased person before they actually remove the eye. It is very important to take the written consent from the patient relative. And eye should be donated within 6 hours of the death. So this is all about eye bank.